Welcome to the Impact of Educational Leadership podcast with ID3 for Isaiah Drone III. This show was designed to provide an exclusive forum on educational achievement gaps related to learner success while discovering relationships and family issues in a diverse setting. All right, this is another night of the Impact of Educational Leadership. This is episode 34. I'm your host, ID3 for Isaiah Drone III. Tonight's panelists are Dr. Badiana, Osabutey, and Mr. Rick Beaule. First, let me tell you about Dr. Osabutey is really from Ghana and took advantage of an opportunity to reunite with her family and relocated to the United States of America. Has professional affiliations with the Institute of Chartered Secretaries and Administrators from the United Kingdom. Graduated in 1996. Then she continued on and upgraded to a higher ranking professional. She also has affiliations with the International Professional Managers Association, IPMA for short, and for Chartered Institutions of Administration and Management from Ghana. Her academic credentials include Executive Masters in Business Administration with an emphasis in finance and a Bachelor's of Science in Nursing. Currently, she serves in the healthcare and is a registered nurse. She has a myriad of exposures from growing up and taking leadership roles from all over the countryside and the different countries in Africa. Next, we have Mr. Rick Beaule. Mr. Rick Beaule has a Bachelor's of Science in Music Education from Indiana University, a Master's of Science in Educational Leadership and Administration from Duquesne University, a 17-year teaching veteran in Pennsylvania and Texas, serving as president of the Clean Educators Association and Region 10 of the Texas State Teachers Association, representing well over 3,500 educators across Central Texas, currently teaching elementary music in the Killeen Independent School District near Fort Hood. Ladies and gentlemen, please say hello to the people.
Good evening, good evening. Hello.
Tonight's topic is one that we have been hearing in the news, and that is how can we better equip the medical and educational supply chains. As global spending on healthcare and education increases, U.S. service improvement is not adequately reflecting positive usage of the consumption of these resources. All too often, we see healthcare organizations run low on supplies. We will be discussing how we can better equip the medical and educational supply chain. My first question is for Mr. Rick Beaule. How are you doing, sir?
I'm well. We're healthy. We're sheltering in place, spending a lot of time with our pets.
Glad to hear that. Mr. Rick Beaule, we're here with Mr. Rick Beaule, by the way. And question for you, sir, are, especially during this pandemic, what are some things we need to put in place since this outbreak of the coronavirus has been out, and how can we put these measures in place to ensure that students and educators are receiving adequate school supplies throughout the different school districts in Texas?
Well, first of all, thank you for having me on. Secondly, thanks for the question and the explanation beforehand. One of the things that COVID-19 has done is that it has exposed a lot of vulnerabilities, or what Winston Churchill would have called the soft underbellies of society. You see a lot of it in the medical field right now, and I'm sure Dr. Osabutey will elaborate on that. But it's also present in the educational field, as you mentioned earlier, because public education has been rather abruptly tossed into a digital learning environment. And that soft underbelly of the digital learning environment is all about access. Now, knowing that we were going to be talking about supplies and supplying learning, I sent in some slides beforehand, so hopefully everyone can understand where I'm coming from, so hopefully your viewers will be able to see them on the screen. Your barriers to access can essentially be grouped into three main areas: equipment access, infrastructure limitations, and financial limitations. Now, for purposes of discussion and illustration, I'll just use my county of residence, which is Bell County, Texas, about an hour north of Austin. So let's deal with unpack the equipment access first. All right, you have school districts that have students and families that don't have the equipment to even get on the internet. So they're trying to loan out laptops and iPads that they have in their inventories so that students who lack those devices can access distance learning opportunities. I mentioned a couple of weeks ago when I appeared about districts like Dallas ISD buying hotspots. Today I found out that Lockhart ISD's purchased access on several cell phone towers to provide access in the district. And I've even heard of several physical sites being set up in places like parking lots or in buildings where they can do physical distancing, where students can access a computer to learn. But we still don't totally know who doesn't have that access. Because they either don't have access to the internet or they're choosing a paper packet because they don't want to, which we've had several examples that we know of. So it's difficult to nail down solid numbers as to where that access is an issue. So next, when you deal with infrastructure limitations, I got coverage information from a site called Connected Nation Texas. It shows internet access and coverage for all 254 counties in the state of Texas. Again, I'm using Bell County for my example. And if you look at the first example in Bell County, it talks about households that have access to what I would call basic internet access. That involves internet download speeds of 10 megabytes per second and upload speeds of 1 megabyte per second. And if you look at that map, it looks pretty good, 99.69% coverage of households. And that's almost the entire county. So that's great, right? Well, not so much. Because the problem here is that basic internet speeds are really, really slow. Just in comparison, the average cell phone speed is double that, at 20 megabytes per second download. So when you look at the streaming requirements of most digital learning programs like Schoology and Edgenuity and things of that sort, you really need to have some form of broadband access. Your basic broadband access uses download speeds of 25 megabytes per second and upload speeds of 3 megabytes per second. Adequate broadband access, 50 megabytes download speed, 5 megabytes upload speed. The optimal broadband access that you can pretty much get in the public realm is 100 megabytes download speed and 10 megabytes upload speed. Now, when you look at the slides, the remaining map stuff, you can see that the coverage dips about half a point for basic broadband, so it still looks decent. Adequate access drops more, down to about 97% change. Optimal broadband goes down even a little more to 96%. But if you look at those slides, you can see that that area that's covered goes down much further because it's talking about population having access, not area. So those students and families in rural areas are at a real disadvantage when it comes to their urban counterparts in the terms of the quality of their access. So now the last issue that I spoke about was financial access. And if you're poor, internet access is a luxury, not a necessity, because there's other bills that have to come first. Bell County has a poverty rate of a little over 14% for those who are born here, and almost 15% for those who come here from other places. So you're talking just in the first category alone, 40,000 citizens who likely cannot afford internet access. My district hasn't released any statistics, and I don't think anyone has, on how many students are using paper packets in lieu of distance learning. But any of those students are automatically at a disadvantage compared to their classmates because they lack even that interaction with their teachers who are online. There's been numerous reports coming out of parents and even teachers who live in rural areas spending hours of their day in cars in places where the cell signal is strong enough to do the work that needs to be done. Teachers trying to set up older iPads to learn to students or families to get them to learn. So you have a situation where the learning opportunities are unequal, and that's not surprising at this point in history because this is the first time we've had to deal with this. But it does point and expose a need to improve the infrastructure when it comes to internet access. And while the private sector has offered opportunities for free access to the internet to this point, they've balked at expanding internet access points in rural areas until they're short of a profit, saying that there's costs in the thousands or more to do that. So the only possible long-term solution to this is an intervention by the state legislature to provide funding for expanding that access into rural or uncovered areas. Now, they, like the private sector, haven't been willing to do that at this point, so we're going to need to see if the weakness that's been exposed in the COVID crisis changes some perceptions and minds as to the need to expand that infrastructure. So it's a lot of stuff, but it's very important because it impacts our students in how they look at stuff and learn.
Thank you, Mr. Beaule. You are such a skilled panelist. I like how I can ask you questions and you go right to it. I really feel that you elicit high quality information to help educators organize better and to instill more structure in the things of academic success and academic achievement gaps. And so, Mr. Beaule, thank you again for that. And I want to kind of shift it a little bit. And I want to go from the educational sector to the medical sector now. And I have here tonight a very special guest. That's Dr. Badiana Osabutey. And how are you doing tonight?
I'm doing great. Thank you, Isaiah.
Wonderful, wonderful, wonderful. So my question to you, Doctor, is what are some things we need to put in place that healthcare facilities are receiving adequate medical supplies, and how can we keep track of that? That's my question to you, Dr. Osabutey.
Thank you, Isaiah. Well, we know that COVID-19 is infectious. We know it is airborne. We know it is contact. We know you have to take very good care of yourself. But because there weren't enough supplies, we were reusing what we have already. So we're cross-contaminating not just the patients, but ourselves as well, exposing ourselves to this deadly enemy of ours. So I would like to say that was ugly, and you can't blame any other person, but it's the situation that we find ourselves. There weren't enough supplies for us to use, so what do? You have to don up and doff off anyway, but if you need it, then you need to wear it. We've been working long hours, and sometimes you're left with yourself, especially with COVID. If you're taking care of COVID patients, you are by yourself, and it's a total care for the patient, which is too much for an individual to do. But what can we do? All that I say is choosing to do this work is sacrificial. It's a choice that we do sacrificially. And although we most times hear from our patients, thank you, thank you, thank you, the payment is not even enough. It does not commensurate with what we do out there. Emotionally, we are there for them. We are there socially for them, just to excite them, to get them back on track, just to get them back on track. So it's a sacrificial area that I'll say it takes a lot of heart and a calling for you to do the job that we do. Again, the healthcare facility remains the beacon of hope. So if you're there, know that you're there to give yourself, give your all, not just to your organization, but to your patients. Do it selflessly, and who knows? But with that exposure, it's just so deadly, and a lot of nurses. So there's a shortage, and a lot of nurses are leaving the scene because of just that. They want to protect their families.
Wow. You know, Doctor, you got me over here. I'm torn to pieces because I hear your transparency. I hear your heart. I hear your story. I respect your story. You are the voice for millions and millions of RNs throughout the world. You are that voice. You are the person that is telling what's going on behind the scenes. And I so appreciate you, and I so respect you. I respect you for what you're doing and what you have done so far. And I want to say thank you again, because we are also seeing shortages in the supply chains with students, especially now that we have these virtual classrooms, and now we're trying to get these students to log in and do work and then monitor this. Plus, we're kind of monitoring the achievement gap. Some schools have just said, we're going to give them a pass-fail. Unfortunately, we don't even know yet, but there's talks of some school districts saying that kids will have to repeat their grade, or if they continue on to college for the high school kids, it may reflect their GPA. And so if they're athletes, they may not get a chance to play. I'm so glad we have you here, Mr. Rick Beaule, because I want to ask you a question. What are some of the supply chains that people in school districts are using that are improving the achievement gap and increasing test scores and graduation rates at this time?
Well, I think, frankly, you kind of hit the nail right on the head. Because right now, other than allowing our current seniors to graduate, the issue of graduation and test scores isn't an issue yet. STAR exams are canceled for this year, as is the HREF grading system. Many districts have also canceled teacher evaluation. But as you pointed out, there's a very wide patchwork of district approaches to student learning. Whether it's pass-fail, just reviewing previously taught material, to some districts are trying to forge ahead with new material. And all of this still fits in legally at this point because there's been very little guidance from the Department of Education in Washington, D.C., and neither TEA nor Governor Abbott have provided much specificity in their expectations. So it's really important to point out that even with all of the innovations that digital learning has provided prior to COVID-19, those things were not done in a fashion where it becomes the primary form, right? And so the digital environment carries with it some pretty substantial limitations when using it in that way as opposed to a brick and mortar classroom. So for example, anything that was used physically in the classroom doesn't work, right, as a manipulative, something physical that they have in their hands. It doesn't reach all of the students in a digital environment unless all of those students have that same type of manipulative that they can then use. In many districts, especially with the shelter-in-place orders or the stay-at-home orders across the state in various areas, have been very quick to very correctly require that teachers cannot require the purchase of supplies as part of their teachings, Colleen being among them. Because when there, like I said, there are restrictions on travel, forcing parents to go out, it would expose them to unnecessary risk to COVID infection. And with the job losses that folks are enduring, in a lot of cases, parents don't have the extra money to spend on specialized supplies. So the idea of supplying things like so much else in this time of COVID that Dr. Osabutey has just spoken about has just literally been turned on its head. So what that means in terms of education is that the educators have had to undertake sometimes Herculean efforts to shift instruction, methods of instruction, and types of instruction to accommodate this new digital environment and find alternative ways for instructing students and finding new ways to create or substitute manipulatives. So they're suggesting using things like paper clips, playing cards, dominoes, beans, Legos, making their own grid squares. I know of at least one case where a teacher even made a kind of a schedule planner for a family to help them pace their learning throughout the week. Now, one thing that everybody needs to bear in mind is that this process is in its infant stages. It's just beginning. We've just taken the first initial steps. As a friend of mine put it, in many ways we're learning how to build and fly the plane while we're hurtling through the air. So really what we are looking for, what I'm looking for from the governor and TEA and even from Washington, D.C., if Ms. DeVos decides to do so, what we're looking for here, what I'm looking for is a clear set of guidelines on the expectations for students, for parents, and for educators. So I'm looking for evidence from school districts that the long term is being looked at in terms of instruction and assessment, and that a synergistic environment is being created that uses all the stakeholders to not only pass problems and issues up the chain for resolution, but also gives us a chance to apply the tens of thousands of years of collective knowledge that we have just in Texas alone to come up with creative and innovative ideas to spark learning, and not just our young learners, but our older learners as well. I'd like to see specific programs that target and take care of the unique requirements of our special needs students. Some of that stuff is just in desperate need of overhaul and figuring out how to do that in a digital world when we have stay-at-home orders. I'd like to see programs being created that help some of our less technologically comfortable educators and students succeed and thrive in this new world. We have to make sure we provide for those needs as well. But I think if we can iron those things out over the next few weeks and, if need be, months, we can not only provide for students' basic learning needs, but it also gives us a chance to really innovate and leap forward into the 21st century, maybe a few years late. But it'll give us a chance to do so with confidence and with pride, and we can really change how we provide our education, be it brick and mortar or digital learning. I don't think education will be the same from here on out. It's going to change as a result of this, and I'm really hoping and praying that it will do so for the better.
See, we need people like you with that type of perspective moving forward after on the other side of this COVID-19. People like yourself, sir, that's tuning into the fact that, those core leadership values, right, for leaders and their staff members still need to be promoted going forward, moving forward. Those growth mindsets still need to be looked at and re-looked at in a different lens, because there's going to be so much reconstruction. There's going to be so much repair. This pandemic is pretty much a war. And so after every war, there has to be a reconstruction period. And I really like the way you promoted human culture, though you didn't mention that term specifically, but it exuded out of your conversation, out of your content, out of your knowledge base, right? And so that is the vision that we need moving forward, to keep track of the learning sessions. Right now they're virtual, like you said, for some school districts. Some school districts, we don't know what they're doing. That's not really my job, right? But those jobs are for those governmental agencies, officials to sit around the table and kind of come up with a plan to say, all right, how are we going to keep this nation moving forward? So we need models. We need models from other countries and see what they're doing that's working, right? And so, I want to kind of shift the question here to Dr. Osabutey, because the medical field, the healthcare agencies, right, they have been navigating this corona epidemic much longer than we have. I think all the way back until some people say November 19th. I've heard and I've read some articles where we knew about this thing, we were warned about this thing back in 2017. So, with that being said, Dr. Osabutey, my question is for you. My next question is for you. And Mr. Rick Beaule, I just want to thank you again, because you helped us tonight. You helped us in this discussion, right? And to me, it was about equipping school leaders. And I love the compassion that you gave. And I just like the integrity that you had in the research and the content. So I want to thank you again, sir, for that. But Dr. Osabutey, my question, absolutely. My next question is for you. What are some of the countries that are successfully managing this coronavirus outbreak?
To the best of my knowledge, South Korea, the model in South Korea was a game changer. For what they did was broad testing of people. And I can see that New York Governor Andrew Cuomo is also insisting on that. South Korea tested over 440,000 people for the virus. It was an aggressive move. Just to test, they didn't just test, they were testing them and those who were. So what they did was, the authorities were able to identify those who have been infected with the disease. They isolated them, they traced their contacts, and then they tested those contacts and treated them as well. So it was an ongoing process. That's why we need guidance, we need supplies, we need resources to get this done. And there again, Dr. Angela Kalindo, an infectious disease professor at Brown University Alpert Medical School, has also expressed the same sentiment, that I think the testing done in South Korea helped them to handle the outbreak?
We don't know what it is. It's almost like it's a plague. You know what I mean? It's like it's nothing we can do about it. We just got to wait it out. Mr. Beaule.
And we should be seizing this opportunity to help people up in long-lasting and permanent ways, and allowing ourselves in the process to put some demons and some things that have bedeviled us as humans to bed, that are long overdue to go to bed and to be put to bed. So I would say that's probably my takeaway from tonight.
Absolutely. Well, this was another night of the Impact of Educational Leadership, episode 34. Welcome to the Impact of Educational Leadership podcast with ID3 for Isaiah Drone III. This show was designed to provide an exclusive forum on educational achievement gaps related to learner success while discovering relationships and family issues in a diverse setting.